Hi again. How are you? Welcome to another episode of Dr. Pam Obare. Today I'm going to talk about women's health, and I'm just going to give a few tips about women's health. One of the biggest things that, especially women who are 30 and above, one of the biggest things that you need to do is make sure you drink your water. Water is very essential. Water. Water, when you drink water, it helps you with your skin. You have a radiating skin. It helps you with your digestion. It helps you with so many things. So drinking water is one of the most essential things that you should do. Point number 2 is rest. You need rest, at least 7 to 8 hours of rest every day, because your body needs to rejuvenate. When you get rest, your body rejuvenates and you feel much better. It's hot here. You feel much better because your body is well rejuvenated. Point number 3 is stress. Whatever you do, you need to cut down on stress. I know everybody gets stress, but too much stress is not good for your body. It makes you develop diseases like cancer, develop things that otherwise a normal body will not develop. So try to avoid stress, try to get enough rest, drink a lot of water. Another thing is that women who are over 40, go for your physical, do your mammogram, make sure you're checked. Some of you have insurance, but usually you don't have time to go for your annual or physical exam. It is good to go for a breast exam. You can let them have a baseline. Once they have a baseline, from there they can check. Early detection helps prevent complications of breast cancer. And also for black women, black women are lessly diagnosed, but when you're diagnosed, you actually are prone to die of cancer. So it is good for you as a black woman that you go be checked. You're over 40, you have a history of breast cancer. Your mom, your dad had breast cancer. Yes, dad too. If they had like colon cancer, so that means that gene is in the family. So make sure that you go do your mammogram. Another thing, women who are over 50, do your colonoscopy. Nowadays they have something they call Cologuard. Cologuard is where you go home with a small container. You put your poop, your BM, bowel movement, scoop in a spoon, put it in that little container, send it to the people. They will check for you and see if they can see any cancer markers. If they see anything positive, then they will notify your provider. They'll call you. You go for a colonoscopy. I know most people don't like going for colonoscopy because of the preparation, the prep, the pooping and all that. It scares people. But if you can do Cologuard, next time you go to see your doctor, ask if you can do a Cologuard, where they send the container home, you do it yourself, and then send it to the lab for them to check for you. Very, very important. For men, every time you go for your physical, you're over 40, check your PSA level so that they see if you have any cancer markers. That is very good. Also, digital rectal exam for men is very, very important. Make sure you check. Once you check, if you have, because sometimes men have issues with peeing because their prostate is enlarged. Sometimes it's as basic as giving you Flonase, or I mean not Flonase, Flomax. Sorry, Flomax. It will help you pee, but also early diagnosis of prostate cancer can save lives, especially if there's a young man who gets prostate cancer. It spreads faster. Older people, breast cancer doesn't spread as fast as young people. So young people who have who have prostate cancer, you need to be checked immediately. You need to go straight for workout, and you need to be checked to make sure that there's no complication. What else? Rest, water, stress, mammogram, colonoscopy, PSA level, digital rectal exam. Thank you. Digital rectal exam. You check that and make sure that it's okay. So those are just a few tips, just for 5 minutes. A few tips, things you can check. Also, go for your dental exam. Sometimes your dentist can tell if you have issues. Go for your eyes exam once a year. All this makes a big difference. Thank you, and be blessed, Dr. Pam. Be blessed. Have a nice day. Bye-bye.